I want to state up front, unequivocally and without doubt, I do not believe that any ethnic, racial, or gender group has an advantage in sound judging.
On the first day of questioning, Sonia Sotomayor trying to roll back those wise Latina comments that have been at the heart of the matter.
The home run derby exhibition portion is over, and this time it counts. Sort of. Topline starts right now.
Welcome to ABCNews.com's Topline. I'm David Chalian.
And I'm Rick Klein.
Each weekday at noon Eastern, we're bringing you the latest political headlines, insight, analysis, and reporting. Everything you need to know before you head to your big lunch.
And keep the conversation going. It's twitter.com/thenote. Let us know what you think. Questions for our guests. We'll be there to respond.
It is still Sonia Sotomayor dominating all. Get us started.
Indeed. Rhetorical flourish. That is Judge Sotomayor's explanation for the wise Latina comment that has gotten so much attention in the previous couple of months. She answers those charges for the first time, tries to deflect them a little bit under sharp questioning from Republicans. And at this point, David, we know exactly what the playbook is, although nothing has emerged that I think we can agree that would suggest that this is not on track.
No, it is on track. She hasn't done any sort of big screw up. I have not gotten the sense that it's as polished a performance as I was anticipating from her. She does seem to be a little reliant on notes in a way, and perhaps John Roberts has, set a certain standard that is in your mind, but no, certainly not off track. Pleading for patience. That is what President Obama is going to do today as he heads to Michigan, a state just reeling from job losses at a time when, Rick, Barack Obama is trying to sell his economic plans now. Really, he's trying to sell this plea for patience because he's saying he needs time to show that his plans put in place, stimulus number one, will eventually create jobs, even though nobody can see them yet, certainly not in Michigan.
14% unemployment in Michigan, both local papers in Detroit, tweaking him a little bit on his arrival, saying we need to hear more about what you can do about our economy right here. By Sarah Palin, from governor to op-ed writer. Sarah Palin takes to the pages of the Washington Post today to take on the media a bit and also President Obama's energy plan. And Sarah Palin has said, I guess since the start of this about 10 or 11 days ago when she was getting out, she wasn't really going to stay out of the ideas game. And I think this is one of the clearer signals that she intends to be part of the national conversation.
And it's the issue, energy, that she did indeed sort of try to own at some point throughout the campaign. Advisors, if you can claim that she has many, said this is an issue she should try to own. But it was the tweaking of the media saying that, I'm sorry to disappoint that I'm not joining in political gossip as you guys would like. I don't know. I thought it was the press that's been saying, hey, let's get some substance out of it.
And they responded to Levi Johnston once again yesterday.
Exactly. And taking the mound. President Obama follows in that rich presidential tradition of throwing out the first pitch tonight in the All-Star game in St. Louis. Rick, William Howard Taft, I think, got this tradition started. And we do know that Barack Obama, of course, has been practicing somewhat to try to make sure that it's not an embarrassing ball. And Willie Mays is going to be with him, I think, on the flight from Michigan to St. Louis.
Wow, he's a better athlete than Taft, I think we can agree. Although this is hard, he said earlier today he doesn't think he's going to break 30 miles an hour. And if you need to see how hard it is, check out from last night's World News, our colleague John Berman, a valiant effort. I think it was just outside the strike zone, but it did reach the catcher on a fly. A
little more than just outside, I would say. Sorry, John. But we're going to get started with the huge battle over health care reform, which is dominating all. The president tried to clear the decks yesterday by putting Congress on notice that he wants his plan passed quickly. And we're joined by the longest-serving member of the House of Representatives, John Dingell. Thank you so much, sir, Democrat of Michigan, for being here. We appreciate it. I do want to start on the health care reform. I know that the House is going to have its bill presented this week, and that Speaker Pelosi has told the president that she's on track to get this bill voted on before your August recess. But it seems that conservative Democrats, these so-called blue dog Democrats in the House, have a bit of sticker shock. How are you guys addressing that to bring down the overall cost of this bill?
Well, first of all, I want to make it clear. Everybody in the Democratic caucus wants a bill on this point. There's very little difference on the need, but there is enormous support for the idea it must be done. Clearly, there are going to be some large costs. The question is not so much sticker shock as it is how the health care changes that we're going to make are going to have to be financed. And it will break down roughly this way. Some increases in revenues, some significant savings coming from the consequences of passing legislation like this. For example, elimination of paperwork and red tape. That will be a significant saving. In addition to this, of course, we're going to see some changes in the way the federal government spends money. For example, some Medicaid funds will no longer need to be expended on that and can be expended in the general health care program that this legislation will authorize. So we're going to come up with a way to fund it, and to see to it that we can eliminate this terrible, terrible cost, economic problem, and humanitarian concern from the United States.
Congressman Dingell, you've been fighting for universal health care for going on 50 years now. Is it your sense that this is a unique opportunity, the way President Obama's talked about it? If it doesn't happen this year, it is just not going to happen?
Well, I won't say it isn't going to happen, but it'll be a while before the stars are in proper constellation again. Remember, we have a large Democratic majority in the House. We have 60 votes in the Senate, and we have a Democratic president who is supportive of this. That is an extraordinary set of circumstances that I can't recall back to the days, except back to the days of President Clinton. And if there were certain mistakes that were made that prevented it from happening, I hope we will not make those same judgmental errors this time.
Congressman, you had said that in part this will be funded by enhanced revenues, increasing of revenues. That's taxes, I assume you're speaking of. And
absolutely.
Okay, and I just want to get a sense. The president sort of recommitted to his campaign pledge that he will not raise taxes on anyone earning under $250,000 a year. Does that mean that when you say increased revenues, that you're going to tax the wealthy to pay for universal health care?
I think that this means that there will be modest increases in taxes on persons in the upper income brackets, yes.
Congressman, I want to turn your attention to the economy for a moment. President Obama is headed to your home state later this afternoon, where he'll be addressing health care and the economy, as well as some community college initiatives. And I want to get your sense, 14% unemployment in the state of Michigan. Has the stimulus done enough, or do we need another bite at this, do you think?
Well, remember, the stimulus was just passed. So it is a 2-year program, and it takes a while to get the money out. It takes a while to get the project started. It takes a while for them to have the effect that they get as the money flows through the system. We're watching the whole situation very closely, as is the president, as is the leadership in the Congress, as is the administration. And we think that if more is needed, it will be done. At this particular time, it would be a bit premature to do anything.
But I guess if this is a 2-year program and this stimulus will take a lot of time to have its full effect, what is the benefit of a second stimulus? Let's say you say it's premature now, let's say in the fall. How will a second stimulus inject life into this economy more quickly?
Well, this is one of the questions we don't know. So we are watching it very closely to see what is happening. Remember, we have put into the economy $786.9 billion. That's an awful lot of money. Michigan got $18 billion. Other states have gotten similar sums dependent upon their population and economic situation. So having said that, the money is there, the money is flowing through the system. Now, it may well be that we find we have made mistakes. It may well be as we go forward that we will find that we should have spent more money. It may well be that we will find that everything went just right. But about 4 months after we passed the legislation is too soon, quite frankly, to make a judgment as to how this is going to impact the United States.
Finally, sir, one more question on health care. In your judgment, does a public option need to be part of any reform that Congress passes this year?
I don't see any way around it. I've investigated the insurance industry, and I've found scandalous misbehavior. First of all, there's no real competition in the country from the insurance and amongst the insurance industry. Second of all, there is a total incapability on the part of the states to regulate the insurance industry. And I have found scandalous misbehavior on the part of that industry. Beyond that, I have found behavior which, quite frankly, is disgraceful. I found, for example, one poor devil got sold 37 different policies, all of which could not go into effect if you had other policies. So here's a guy paying 37 policies that he's been high pressured into buying by a health insurance company. So now that's bad. But then you have pre-existing conditions, and you have a nasty practice of the insurance companies called rescission, where they cancel your policy as you're on the dolly being rolled into the operating room.
Congressman John Dingell, thank you so much for being with us today. We appreciate it, and we'll continue to watch as you guys try to get this healthcare bill passed.
Root for us.
I don't know
thank
about
you.
that.
Thank you, Congressman. Appreciate it.
We'll be back with more Top Line in just a moment. Kevin Madden's coming up. Don't go anywhere.